So Doctor, we'll go to the questions.
Yeah.
Hi ma'am, my name is Asitul Tesha. I'm doing my second MBBS. I have the doubt that why teens get diabetes?
Well, diabetes in teens is, in the earlier days we used to think, diabetes in teens is primarily because of, we just used to categorize it as type 1 diabetes. If it is diagnosed as type 1, then we need to confirm it by certain test which will say whether it is type 1 or type 2. But of late, there are young individuals, young children who are 10 years and above, who are obese, who have got risk factors, especially family history. They tend to present with type 2 diabetes, which are usually found in individuals who are more than 30, 35 or 40. But typically type 1 is primarily it is immune mediated, it is an autoimmune, and there are many other things like which it's an idiopathic etiology. So type 1 is basically immune mediated and idiopathic. There are teenagers who get type 2 diabetes, which again is because of obesity and insulin resistance.
Okay. So the most common diabetes is the type 2?
Type 2, that's right.
Okay.
The most common is in type 2.
Okay. So Doctor, what are the complications of diabetes actually?
Well, by and large, diabetes has got microvascular as well as macrovascular complications. Microvascular mainly includes diabetic retinopathy, diabetic neuropathy, diabetic nephropathy. Diabetic retinopathy primarily involves your fundus, your eyes, your vision. And neuropathy, it involves your peripheral nerves, and nephropathy involves kidneys. And typically people who have got diabetic retinopathy, they present with sometimes they say that they have got a blurring of vision, they have got some visual disturbances. Hence whenever a diabetic patient needs to get his fundus examined at least once in a year on a routine basis, irrespective of whether he has got any visual disturbance or not. And as suggested by the ophthalmologist, if he has got some changes, some fundal changes of diabetes, he needs to review it maybe after 3 months or 6 months. And and a repeated change of the power of the lens can give a clue to the clinician that this person's diabetes is not under control. So whenever we go to the ophthalmologist, they say that first get your sugars done. If a diabetic patient goes to an ophthalmologist, he says first get your sugars controlled and then you come to me. I'll just alter the power of the lens, because
unless you correct
the sugar levels, the power may not be stable. Well, that is one aspect of it. And then there are other things like there are micro neovascularization and the retinopathic fundal changes. So we need to get the eyes checked at least once in a year, and then at the same time we need to get the kidney functions done at least once in 6 months or maybe at least in a year. So we can have the gross renal parameters, especially the blood urea and serum creatinine levels, as well as the microalbumin, which can give us a fair amount of idea how good the renal status is, and we can alter the medications as required. If you monitor the renal functions. And the other aspect of the microvascular complication is a diabetic peripheral neuropathy, where many times the patient says that he has got some kind of a tingling, numbness, or lack of sensation of the lower limbs. So this also is manifold. It is directly proportional to the glycemic control, how good the sugar controls are. So one needs to keep on we can do a simple test examinations to see whether the person's the sensory perceptions at his feet is at the sole of the feet is perfect or not. So a diabetic patient should keep on monitoring and his foot. The foot care is of real importance in a diabetic patient, because the sensation in the sole of the foot for a diabetic patient is many a times less compared to a normal individual. So he need to examine his foot, self-examination of the foot regularly, just to see if there are some minor injuries which he probably might not have noticed. So, or at least ask his counterpart to get the feet examined, or keep a mirror in front of his sole, and then he can have self-examination. He can see if there are some minor wounds. So these are the microvascular complications which we commonly encounter. Macrovascular complications, of course, atherosclerotic changes and coronary artery disease. These are some of the complications which are associated with diabetes. Stroke is another complication which is again associated with diabetes. Which these are all directly proportional to how good your sugar, your glycemic control is.
That means diabetes affects almost all the organs in the body.
Every organ in the body is affected by diabetes, but it is such a disease. If you control it, you can live with it. You need to understand the disease. You need to accept the disease, and you can have a healthy life. But if your lifestyle is not up to the mark, or if your lifestyle is wayward, I guess probably you'll have a tough time.